As the public information point person for dozens of local hospitals, Krista Hyson understands why people who are not medical experts are questioning the way COVID-19 vaccines are being administered.
I know it can be kind of confusing to receive the information where it's like, well, this many doses were given to you, but only this many were administered. Why is that? Well, it is such a complex process. We are making sure we are hitting the right people in the right phase in the right time.
While critics at the national level complain about vaccine promises versus reality, Hyson and others involved in the vaccination planning process here are comfortable with where things currently stand.
So far, so good. So some of the shipments that came in were more than we expected, and some of the shipments were less than we expected. But here's the good thing. In our Southwest Ohio region, we're good at sharing.
You can always look at after the fact and say, hey, maybe a different structure would have been better. But that was what the federal government created, and Ohio is simply implementing that. And it seems a lot of people are getting vaccinated quickly.
Speaking today, Ohio Governor Mike DeWine said Ohio can only distribute the doses of vaccine that the state receives. While he called that a supply problem this afternoon, DeWine sang the praises of UC Health for getting shots into the arms of frontline healthcare workers as quickly as possible.
It's nice to see that what we're doing is recognized. Obviously, the most important thing is that we help everyone to be as efficient as we've managed to be. So managing to make the right decisions at the right time in a quick manner is really what makes the difference.
Now that's Dr. Dustin Calhoun. He's an expert in vaccine logistics at UC Health, and he knows it's easy to be critical of the rollout, but he says the process, again, so incredibly complex that if it's not done the right way, then that would create even more consternation. Reporting live tonight, Todd Dykes, WLWT News 5.
Todd, now the next question everyone wants to know, do the experts that you talk to know when more groups of people will be able to get vaccinated?
Ashley, that's the million-dollar question, right? Dr. Calhoun, who again, knee-deep in that vaccine planning, says he wishes he could give an answer, but he said there's simply too many variables right now. For example, it's hard to figure out just how many people will fit into the next several categories of the vaccine rollout. And even when you know that figure, Dr. Calhoun says you have to figure out how many of those people will actually want to get the vaccine. He says a miscalculation on either front could really slow things down. Ashley?
All right, Todd, thank you. And despite hurdles